I want to tell something and tell a story about not only the age of urban tech, but the aging and urban tech, as you can read on my slide. But let me share, first of all, a short personal story, if the clicker works. So you will see my grandmother, my mother, and my sister. And when my grandmother started to get dementia, and my mother and my father and their brothers and sisters had to take care of her. To be clear, my grandmother is the one in the middle. When she started getting dementia, my mother and father had to take care of her. I saw a big struggle in communication, in organizing, and so on. And when she passed away, sadly, a couple of years ago, my mother told me after the funeral, like, we will do everything to avoid that for ourselves. So there's a completely new generation coming up that will handle care and take care of themselves completely different ways than we do today. And it's all about independent living. How can we just stay autonomous, take care about ourselves as long as possible, stay in our own environment as long as possible. And about the numbers you already heard from Noreen. So this was 11% of 60 plus people in 2006. Well, in 2050 it will double. And it will be a big burden on our society, obviously. And also cities play an important role in this, because cities hold 43% of 60 plus people. And this will even grow in the future. And there is a big trend and a big change because of that burden on society, is that we all have to take care more about ourselves. The move from healthcare to self-care is significant and also important. But if we want to let people take care about themselves, we have to provide them the tools to do that. And when you look at technology these days and about these tools, it's very fragmented. For example, the guy in the middle, surrounded by doctors, nurses, children, and so on. They are all going towards technology, using technology to connect or try to connect with their clients or their family members and so on. And you see a complete diversity in user interfaces. It's all siloed, it's fragmented, it works differently. You need different authentication for all these different websites and apps and tools. The Internet of Things is coming up, sensors that connect to the internet and collecting data. And look at this slide, my friends. This is a mess. And this is the same metaphor that everybody would put their own remote control on your table, and you have to cope with all this complexity. And that's what we want to solve. And then Cubigo came. And together with my co-founder, who is a general practitioner, we built a software platform 3 years ago. And actually, we integrate this whole stuff into one very intuitive, personal platform where you can use all the different applications the same way with one login. Very easy to use. For example, this is video communication with the doctor or the nurse or maybe the grandchildren. This is ordering your meals or groceries to deliver at home. This is a weight scale, which, by the way, was my data 1.5 years ago. Now it's going into the other direction, so I won't show it. But this is a weight from someone's weight scale. This is a medication reminder system where you get medication reminders configured by the doctor and so on. And our goal is to be the app store and even the curated app store for healthy aging services. We roll out this not directly to consumers. We always leverage organizations like care organizations, care insurance companies, senior care providers like this one, but even municipalities, neighborhoods, and cities to bring the platform to the end user. I'm from Belgium, and our neighbor country is the Netherlands. And in the Netherlands, they changed the healthcare system in that way that cities and municipalities are responsible for the budgets for long-term care. So that means that a city has a lot of money to take care of about their elderly, and they roll out over a whole city this kind of platforms. So there is only one infrastructure, one platform that all the different care organizations and service providers have to use to reach the seniors in their city. So that's very interesting for us as well. And then the last one, member organizations, senior member organizations that use the platform to communicate with their members and so on. We even implement this platform via Cubigo cafes, Cubigo bars, where you bring together a lot of seniors with coffee and cake. that works the best. And they connect with each other, and not only online, but even offline. And when they go home afterwards, they can also connect via the platform with each other, and to fight loneliness and to avoid isolation and so on. We recently launched, or we went out of the beta phase like 1 year ago. Currently, you have more than 20,000 users, mainly in Europe, Belgium, and the Netherlands. But recently, starting in the United States, with a first customer in Columbus, Ohio, of all places. I was never been there, but very interesting to see because the market is much bigger, of course. And the question related to this topic of today is the urban setting, and is this the future? Do we all want to put our seniors or mother, father, dads, and so on in this kind of buildings? This is Dutch, and on the wall it's written nursing home. I totally believe that in 10 years' time we completely will change this, and people don't want to go to this kind of buildings anymore. And I was, well, later on I'll tell you, but I was walking in Montreal, and I really came on the idea about why don't we call it virtual assisted living? Why can't we just upgrade existing infrastructure like apartment, flats, houses to make them virtually connected and act as a virtual assisted living house? So I said I was walking in Montreal. I climbed, it was on Saturday 2 days ago, I climbed on the Mont Royal, which was a very compelling sight, if you can see like this. And I was thinking about myself, like, for example, that apartment over there. Maybe it's an office, I don't know. But suppose that this is an apartment where a senior lives. Why don't we try to make that virtual assisted living apartment? Where you have that apartment and using technology and the internet and all the different things I already talked about to empower this person to just stay there for 5 or 10 years more with social contacts, as I said, connection with the grandchildren, connection with events, neighborhood events, and maybe patient groups where people can connect with and communicate with. But on the other side, comfort services like delivery goods at home. We have an office in San Francisco, and they always say San Francisco is assisted living for young people, because you can use all the on-demand services like Uber and get your laundry done and everything. And why don't we can do it for seniors with a very simple to use interface, or maybe the children who are living 1,000 miles away to do that for their children online, for their parents online, and so on. And then third, which is very important, obviously, is the Internet of Things. On the left corner down there, you see an activity monitor, which are small sensors you can put on doors, for example. Imagine that you put a sensor on a bathroom door, and you know how many times somebody goes to the toilet at night. And you combine that data with his weight scale I showed before. And you see that someone is going more and more to the toilet, and combining that with weight that goes up for a month, well, a smart algorithm could say maybe there is a diabetes problem coming up, that kind of things. Or when you order your meals, and we know that you are a diabetes patient, why don't we offer you meals that are good for you without sugar and that kind of stuff. Second, down there is video consultations, I already mentioned. Remote care, why do we have to queue at the doctor's office for hours, and instead of just doing a checkup via video? And then telemonitoring, like weight scales, blood pressure meters, and so on. And the total package of all the things that you see on this slide, that should extend the way that people can live in their own environment. And obviously combine in one platform. You don't want to have all these fragmented solutions, not only for the senior, but also not for the care organization. All right, this was my presentation. I thank again the organization. Thank you very much for your attention, and hopefully I speak all of you afterwards on the reception. Thank you very much.